Right, good afternoon everybody. Today we've got a number of updates on the steps that we have been taking following yesterday's positive case in Northland. I want to start by giving an overall summary and then I'll give you the latest information from the Pullman Hotel where we know the case was staying. The Director General is going to provide details on testing and contact tracing and a few more specific details around the case. The case has now been given confirmed status. It was a probable case yesterday. It is now a confirmed case. We know that the person's husband and hairdresser have tested negative, which I outlined this morning. That's a very encouraging development. We can also confirm that the strain of infection is the South African variant, and the source of infection is highly likely to be a fellow returnee during the person's stay at the Pullman Hotel. Again, this is good news because it means we know where the source of infection is and we don't have to divert our scientists and health experts from other COVID-related work in order to identify that source. We know that from the genome sequencing that was completed overnight, and I want to recognise the amazing and the fast work done by our scientists to turn that around so quickly. That is a very quick result for the genome sequencing, and it has made a big difference. The two people occupied rooms in close proximity to each other on the same floor of the Pullman Hotel, and I'm advised by officials that they are confident that the infection was a direct one, and that there is no other missing link in between those two people. We don't know exactly how the infection took place at this point, and investigations on that are continuing. That includes looking at CCTV footage from the Pullman Hotel to identify when and where they may have come into contact with one another. It will also, the review so far has confirmed what we said yesterday, that the case, the Northland case, has adhered to infection control guidelines in her room and in the exercise space as we have asked her to do. So again, I want to thank her for her diligence. Everything that we have seen so far suggests that she has done all of the right things. It has been decided this morning to delay the release of people who were due to complete their isolation at the Pullman today. There are 46 people who are affected by that decision. That can be managed within our contingency. They will be staying a little bit longer. An update from the Ministry of Health on that can be expected later on this afternoon, including an indication of when they are likely to be released. They will receive an extra test prior to their departure as an added precautionary measure. Of the 253 returnees who have exited the Pullman Hotel within the new infection window, based on the information that we now know, 172 of those had been contacted as of 8 a.m. this morning, and work has been continuing through the morning and it will continue through today to make sure that we are contacting all of those people. We're advising that those guests who exited managed isolation at the Pullman Hotel between the 9th of January and the 24th of January self-isolate immediately. They should contact Healthline to arrange a test, and they should remain in self-isolation until they get a negative test result. Of the approximately 220 staff who work at the Pullman Hotel, 114 of those have already been tested this week. The remainder of them will be tested later on this afternoon. I'm advised that those tests will be completed by 4 o'clock. Therefore, we should have the results of those early tomorrow. We already have some of the strongest infection prevention and control measures in place in our isolation and quarantine facilities, amongst the strongest anywhere in the world. And we do monthly audits of those to make sure that we're keeping them up to date and to identify where they can continue to be improved. However, as is normal in a situation like this, an investigation is being carried out urgently to look again at whether there are any further changes that might need to be made. Officials are already getting more information based on the genomic testing, which will help us to determine how the infection occurred, what we can learn from it, and particularly in light of the new variants that we're dealing with around the rest of the world. That will also include looking at whether returnee movement should be restricted towards the end of their stay in managed isolation after they've had their final test and before they have been released. Work has already started, as I indicated this morning, on the installation of new filtration devices to the air conditioning systems in our managed isolation facilities. Before I hand over to Dr. Bloomfield for more information, I do want to reiterate a few key public health messages. While officials are working as fast as they can, there are things that every New Zealander can continue to do to help. Get a test if you are feeling unwell and isolate until you get the result of that. Please do not go to work or out in public if you are feeling unwell. Scan everywhere you go, switch on Bluetooth. I'm advised that there has been a surge in people switching on Bluetooth in the last 24 hours. And wash your hands regularly. Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. Just before I provide further details on the case, I'd like to also confirm that there are 6 additional managed isolation cases to report today, and the details of those will be in our media release. So contact tracing on the case that we're calling the Northland case, January Northland case, has identified 15 people who are being treated as close contacts. The reason this number has gone up is that there are 13 of them who are in 2 retail settings, and it's not immediately clear which of these people served the case, and so all are being treated as if they are close contacts. That's why that has gone up from yesterday. All have been contacted, are self-isolating and have been tested. So far we know that the woman's 2 closest contacts have returned negative tests, which is encouraging. As the Minister has said, the results of the whole genome sequencing confirmed she has this, what is known as South African variant. It was a variant first identified in South Africa known as the B.1.351. Now, we're continuing to monitor advice from the WHO on this variant and all other new variants that are identified. However, there's limited epidemiological data available to date on it. What we know so far is that it may be more transmissible, but that's not as clear as the information about the variant first identified in the UK. There are no indications to date for any differences in disease severity or in incubation period. There is some evidence that this variant may evade some aspects of the body's immune response, but obviously it's very early and we will be watching closely just to see, as will other countries, what this means. Now, new forms or variants of the virus have become increasingly common around the world. The key point here is they are now global. They are not confined to specific countries. And we have expected to see them in New Zealand. One of the things we do here is, of course, we do whole genome sequencing on every positive case we get here. So we have a very good data bank of our variants that we've seen in New Zealand. So further on contact tracing, just to talk a little bit more about the cases movements around the community in Northland, I do want to acknowledge, among other things, her frequent use of the NZ COVID Tracer app, scanning QR codes and having Bluetooth turned on. As we've now published on our website, last evening the list of 30 locations of interest was put up, and it's the use of the app by this person that has enabled us to follow up quickly anyone who may have had contact with her and to head off any further potential spread. We do this as a precaution in situations like this, and I can't thank the person enough for her dedicated use of the app. Remember, this could be anyone at any time, and it's up to all of us to help protect each other. The message here is clear. Everyone on the team needs to scan QR codes and enable Bluetooth on phones and on the app. And pleasingly, an extra 200,000 people turned on the Bluetooth functionality on the app yesterday. And I encourage those who haven't done that to do so, and of course to everybody to not only have the app on their phone but to use it assiduously. Last night, as many locations of interest as possible under the time constraints were contacted to alert them that they would be listed as a potential exposure event. We were not able to get through to all of them, and so by yesterday evening we made the call to publish the list of those sites and to send out a push notification to people who had been there. We've also published on our website the potential exposure date and timeframes, and in some cases this is just a 5 or 10 minute period. So when people call Healthline, we want them to be mindful of the date and time of exposure for that location. We need to ensure that our testing stations are testing as a priority those people who were there at those time and dates, not people who may have been there at another time or who are just worried. Of course, anyone who is symptomatic should go and get a test and isolate until they get the results. Push notifications, as I said, have been sent to app users, and the Bluetooth, those who had Bluetooth turned on and may have been identified as being in proximity for a period of time to the case have now been sent a notification as well. And what I can say is there were 162 push notifications to people through the app who had scanned in at the same time into those locations that the case was at. A word on testing centres. There are now 17 additional centres up and going across Northland and Auckland metro region. There is high demand. As I said earlier, we want the people who were at those places at the same time and date to be prioritised for testing. There are a lot of people turning up in Northland who are neither symptomatic nor were at the places. Can I ask those people to stand back and ensure that those who are the priority to be tested first? There is community testing in a range of places around Northland, and those are on the DHB's website, and likewise the Auckland locations are on the Auckland Regional Public Health website. By 11 a.m. this morning, nearly 1,000 people had been tested across the Auckland region. For comparison, at the same time last Monday, that was just over 200. So it's great to see the response. We do want to ensure it is the right people being tested. Remember, as the Minister said, if you are symptomatic, the important thing is to stay home and get a test. Just a reminder that healthcare facilities across Northland remain open. I understand that there are people who are not turning up for appointments at the hospital because they may be concerned. There is no increased risk in going and attending a medical or other appointment at the hospital or anywhere else, and please do get care in a timely way. And finally, the number of tests yesterday was 2,678, and quite clearly we expect that number to be much higher today. Thank you, Minister.
Thank you, Dr. Bloomfield. Before I open up for questions, I do want to return to something that has been a bit of a recurring theme in our COVID-19 response, and you will have heard me talk about it here before, and that is the need for accurate information to reach the New Zealand public. I was made aware last night that circulating on social media were a number of Facebook infographics purporting to announce a lockdown for New Zealand commencing from today. I do want to reiterate that that's fake, that is not true, and that people should refrain from sharing information unless they can verify that it is true. The potential for sharing that sort of information can actually do harm, and so I would just encourage everybody once again to make sure that if you're sharing something on social media, please make sure that it is true. I'll open up, Jess.
Lots of people sitting in lines in Northland at the moment, perhaps some of them watching this briefing on their phones. What's your message to them who they may have been waiting for hours to get a test?
My message to them is if they're showing symptoms or they have been asked to get a test, please do make sure you're getting a test. But I'll ask Dr. Bloomfield to comment on that as well.
Just to add to that, and I endorse what the Minister said, there will be waits in some places. There is a lot of testing available around the community. We have seen this before, and we want people to be tested. We want to ensure the right people are tested because that's how we will confirm that there is no onward community transmission. It's important that it is prioritised for those people who need the testing.
15 stations, so has that been scaled up this afternoon, and how are you pumping in more staff from around New Zealand to support them?
So the staff are from around the northern region, both in Auckland and also from Mangawhai North in Northland. They do have surge staff that they, as DHBs, they are able to add in, so they have increased both the locations and the hours and the number of staff there. So people who are waiting, please be patient. You will get a test. If you're not in one of those categories, it's a priority. I'd ask you perhaps stand down and ensure that those people who are a priority do get tested.
Quickly doing in Whangarei though, because we've had people who've been waiting there since before 9 a.m, no toilet facilities, no food or water available, and they've been waiting. What are you doing in Whangarei?
I have a list, and it is on the website, of course, of the District Health Board and also Auckland Regional Public Health of the places where people can be tested. However, there is always a big increase in volume and an interest in testing when this happens, so people need to be patient, and if they do have to wait, it's a good idea that they do take some food and water and expect to wait.
Have you spoken to local iwi about a response plan should this go out into the community?
No, I have not. I have not personally done that yet. I know that my colleagues, my parliamentary colleagues, Kelvin Davis and Willow Jean Prime, have both been in contact and have been putting out their feelers and keeping in contact with their local communities, as have other members of Parliament from both sides of the House I've been in contact with. So I know that they are up there keeping in contact with their local community members. I also know that the local public health teams do have an outreach program, and I'll ask the Director General to comment on those.
Yeah, the public health units are in direct contact with, obviously, Māori health providers, and they'll be assisting with some of the testing. And also the all-of-government team reached out to the Iwi Leaders Forum yesterday before even the announcements were made, just to make sure they were in the picture, and they've been kept informed throughout.
Minister, you talked about restricting some of the returnee movements after their final test before they leave MIQ. What would that look like?
Look, that's something that I'm getting some further advice on. So it is something that we are looking at, whether or not, and it's still an open question, whether or not that would be an additional layer of protection after people have had their final test while they're waiting for that test result, just to ensure that there isn't any risk of them picking it up in the meantime.
Will you be toughening up MIQ?
I'll come to Audrey over here, and then I'll come back.
Someone with the South African variant, were they there at the same time as her? Like, weren't they shifted to Jet Park?
They were. So they arrived in, and they tested positive. They arrived in just before the day 0 testing requirement was introduced. They tested positive on day 3, so they were moved as soon as the positive test result came back.
Day 3 coincided with her day what?
That was her second to last day. So the person who is the case that our Northland case appears to be infected from arrived on the 9th, and day 3 testing was the 12th, confirmed on the 13th, and moved to Jet Park, and that was the day that our Northland case left. Late in the day, left the managed isolation facility.
And is it possible, like you said, you think it'll be direct contact? Do you mean, could it possibly just be a surface area? Would that be included in your definition of direct?
So by direct contact, the Minister was implying that it's an interaction between the two directly, rather than an intermediary person, because the genome sequence is identical. So that suggests it's a direct interaction. However, the mode of transmission we are looking into, and that could be through respiratory droplet, it could be through air transmission, so aerosol, and that includes potentially ventilation, and we'll be looking at that, or it could be so-called fomite transmission, so a surface. And we're looking at CCTV footage, and both cases are being thoroughly questioned just to see whether there may have been any interaction between them.
Can you elaborate on what you said, Minister, about air conditioning?
Yeah, so we had conversations about this late last year, and I actually just received the confirmation earlier late last week, if you like, that work is now underway in terms of looking at installing additional filtration systems on air conditioning units in our managed isolation facilities. Depending on the assessment of each of those facilities, the air conditioning systems in each are different, and so just depending on what the need would be there, we would look at that. But I'll ask the Director General to comment.
The only thing I would add is that we will be expediting an assessment, working with the Pullman to look at the ventilation system there to just see if it may have played a role in this case.
Would it be normal for that floor in the Pullman to all be sharing the same air in the same system?
Look, I can't answer that question specifically, but what I can say is one of the criteria that is used in selecting hotels suitable for managed isolation in the first place is the nature of their ventilation and air circulation systems.
You've been able to get in touch with some of the business owners in Northland. Some of them have said they haven't had any contact from the Ministry of Health at all. What would you say to those concerned business owners?
I think we had this conversation yesterday where there was some pressure to release the list more quickly. We do take a reasonable period of time to endeavour to get in contact with people who QR code scanning and businesses and QR code scanning has identified as being a potential risk area. But we have to draw a line on that somewhere, and we do need to get that information out to the public, which we did last night. That was published around 7:30 last night. Obviously, Public Health continue to work with those businesses and other entities that are in that group to advise them on what the appropriate public health measures may be to make sure that they're keeping themselves and others safe. So my message to them is keep talking to public health officials about what the most appropriate course of action for them to do is. We'll come back over here. I promised you'd come back over here, but...
Will you be toughening up MIQ restrictions for those coming back from high-risk countries? For example, not leaving their room or introducing rapid testing?
Well, you'll see that we've already made some changes just in the last few weeks, which now means that people are getting their day, they're getting tested as soon as they arrive. They are having to isolate in their rooms. They're not allowed out of their rooms whilst they await those testing results. The issue that we're now considering is whether there needs to be something at the end of their stay as well, just to add that extra layer of certainty. So we will... We'll be getting advice on that.
What about when they leave MIQ? Would you suggest anything like another week in self-isolation just to be extra careful?
Again, that was something that we did review late last year. The advice that I received was that wouldn't be justified. Now, I think if you look at the situation that we're dealing with here, it is highly unlikely that it was extra long incubation period, which would mean that an extension of the length of time isn't necessarily going to do anything to reduce the overall risk profile that we face.
And would you temporarily close the border to high-risk countries such as you did for China last year?
Look, we can't do that on an ongoing basis. Ultimately, we do have a responsibility to allow New Zealanders a safe passage home. That's what our managed isolation facilities are designed to do. There are already quite strict, if you like, limits on the number of people that we can bring in at any given time. People are waiting a long time to get home. Whilst we have an emergency allocation, that is very, very heavily subscribed. A lot of applications get declined for that because it's very, very tightly, the criteria for that are very, very tight. But we do have to provide that opportunity for New Zealanders to come home.
And this individual wasn't tested for 7 days after first getting symptoms. Does this mean potentially it has spread more widely?
Look, I'll ask the Director General to comment on that. We've not yet seen any evidence of that. The fact that the person's close contacts, the results we've had so far are negative, as I've said, encouraging. But at this point in proceedings, you can never say never, and so there's still information we don't yet know. But
just a comment to add to that. Yes, so the testing was a wee way down the track, and my Chief Science Advisor, Dr. Ian Town, suggested that one reason why this person hasn't infected her close contacts, and one of whom she spent a lot of time with, her partner, may be because the CT value in her test was quite high, and also she didn't talk about respiratory symptoms. It was more muscle aches and so on, so she may not have been sort of sharing or spreading the virus much. So that's encouraging. But of course what we want to rule out is any potential people who may have been infected from when she left managed isolation right through to when she went into self-isolation, and that's why we've put the word out.
And what did health officials actually call to check on the woman after she left managed isolation, and did they actually extract all that crucial information at the time as she would have already been unwell?
So she was called on the 16th is my understanding, so it was the third day after she left, and I don't have the detail, but just a brief comment from one of my team yesterday was that she had definitely been called and didn't report any symptoms at that point.
I'll come back to Jess.
Shane Retty raised a point this morning saying that there hasn't been an identification of where the woman actually was tested. Will we know that information, and was that testing station open today?
Actually, that was one of the 30 locations that was put up on the website, was the community-based assessment centre where she was tested, is my understanding.
So when was that put up, that information?
Last evening.
And, sorry, which centre is it? I'm sorry, I think there just is a little bit of confusion about which one it is.
I don't know off the top of my head, but we can come back to you on that with the exact one.
Okay.
We'll come down here, Luke.
Dr. Bloomfield, just you mentioned there that the person involved had more aches and pains rather than coughing and spluttering much. Is that, of what we know of the South African variant, is that in line with that variant, or does that just seem to be a peculiarity of her particular case?
Look, different people report different symptoms, and we know muscle aches and pains, those sort of that classic flu type myalgia, as we call it. Plus, she did have what she reported as sort of chills as it got worse. and she had a mild fever, but she didn't really report respiratory symptoms, like runny nose or a cough. So I don't think that's peculiar to this variant. It was just how the illness expressed in this person. And of course, what we also know is that some people are infected and don't display any symptoms at all.
Okay, we'll come back here.
Dr. Ashley Bloomfield there responding to that question at the news conference, and Chris Hipkins, the COVID-19 response minister. We're going to leave that news conference there. You can, of course, keep watching that on newshub.co.nz or on your Newshub app. But let's now recap that latest information. The community case has tested positive for the South African variant of the virus, which is thought to be more transmissible than other variants.
It's believed the person caught it from another person in MIQ who had a room nearby on the same floor of the Pullman hotel. They're not sure how the infection took place, but they're looking at CCTV footage to try and work that out.
46 people due to complete isolation at the Pullman hotel today will be held there longer and will now have to go through another test.
There are now 15 close contacts of the positive case. 13 of those are from 2 retail stores the person visited.
And that is one of the 30 locations of interest visited by the woman. 17 additional testing centres have been opened, and there is very high demand today.
Well, the Minister says there is also a warning that there are some fake messages on social media about lockdowns, and he's encouraging people to look at reputable sources for the latest information.
And to check before sharing those. Mitch McCann will be here at 4:30 with the latest on this case, and we'll be back at 6 o'clock with a full wrap of the day's development.